Welcome to Building the Best You, a destination for you to reimagine what is possible in your life and then create it. Welcome to the show, everybody. I'm your host, Jeanne Collins, and today we have Dr. Ina Lazar on, and we are going to be talking about eye care. I have to personally tell you, I had absolutely no idea that there was so much going on in the eye care industry until I started to follow her on Instagram. I went down a huge rabbit hole looking at her content till I met her in person and I went to her practice. And just to give you an inkling, there are eye drops that you can use that can help you see folks without reading glasses. So that's just one of the many things I learned when I met her. So I am so excited, doctor, to have you on the show. So welcome.
Thank you so much for inviting me. It's such a huge honor. So let's chat.
Let's chat about eye care. All right, but before we get into the details, because you do so many things that I would have never thought would be part of your profession. I think eye care doctor, I think you go once a year, maybe if you're really good, couple every other year. You sit, you look in that machine, they blow the air in, you get your prescription for glasses. But what you do is on a completely different level of eye care that I didn't even know existed. And so I'm really excited to share that. But before we do, your story is pretty cool. So can you just share a little bit of background about you and your journey and why you got so passionate about eye care?
Oh, absolutely. When I started practicing, I went to school in Pennsylvania, and one of my rotations I did here in Connecticut, and I realized I love Connecticut and I love being so close to the water. So after graduation, I actually decided to come back to Connecticut. And after practicing for about a year, I realized there is a lot of issues that women in particular suffer with, such as ocular surface disease and dry eye. And we had nowhere to send these women. We would see the patient, give them tell them to use moisture drops and send them on their way. And that's when I realized I want to be that doctor that will take care of these women and some men, but mostly women, and help them to look better, see better, and really optimize their health when it comes to their eyes and face. And that's when I opened my own practice in Old Greenwich 10 years ago. I mean, time flies, right? And that's when I started, educating women and implementing everything I've learned and all the new technology that's coming out, how we can improve the quality of life of my patients.
Yeah. And you have two practices, which is amazing. And you're a mom. Like you do all the things. You're like super mom. It is so amazing. You're an entrepreneur. You do so many things. You're so big in the community. You're really focused on building community within the community. So you do a ton of events at your place in Greenwich, which is also so inspiring as an entrepreneur. I love that. You're all about giving back. You're all about helping. You do a bunch of stuff with kids, helping little kids that can't see and have eye issues. You give so much of your time. So kudos and thank you for that. I don't want to skim over how much you give back because I think that's so important as an entrepreneur to demonstrate that you do give back. So thank you for that. But before we
Thank
even
you.
move into all the good things, let's talk about what's the number one reason why people come to you?
So just like you said in the beginning, oftentimes they just feel like they need a new pair of glasses. Their eyes are tired and they think they need just something new in their life. They're unable to read as well, especially that reading experience when you go to a restaurant and you need a flashlight. That's usually number one. And number two, my eyes are always red and watery, and often patients rely on drops to help to relieve the redness. So those are the biggest ones. And then, of course, kids. I see a lot of children for vision issues or sports activities, to we can optimize that as well.
Yeah. Well, and I also love you, and I talked about this when I met you in person, is that you love to uncover the reason behind why these things are happening for patients. So, for example, you and I went down a rabbit hole conversation about hormones, and I had so much to say about my own journey in perimenopause and menopause. And so, can you talk about hormone health and how that might actually be what's causing some symptoms that people have for their eyes, but they're not making the connection between the hormones and where they are with their hormone health and what's going on with their eyes?
It's one of those conversations, where do I even start? Because there's just so much. everything is connected. It's not just, we no longer look at our body as just different parts of organs. It's just like a collection of organs and we separate them and then we treat them separate. We actually view everything as one. And these patients that at least I see, and I've been seeing in other practices, that suffer from often dryness. And, as we enter that perimenopause, the dryness is one of the big issues that we all experience, including their eyes. And the more we learn, the more we have the literature coming out, the more we realize the hormones, especially testosterone, decreases significantly. And that impacts ocular surface and women's health. Again, men, I see a lot of men in my practice, but their testosterone levels are much higher to begin with. So women are going to be much more sensitive to the drop and decline in testosterone. And these are the women that I will see in my practice. And they'll say, my eyes have never been this dry. I can't sleep well. I wake up with dryness. I'm unable to see well. I'm unable to wear my contact lenses anymore. My eyes are constantly red. And I am using Visine to help with that. So now we're just entering this vicious cycle. And we're realizing that it's really every patient is also very individual. Yes, we do need testosterone, but we also need some progesterone and we need some estrogen. And if we change the formula, you can actually worsen the dry eye symptoms and redness and watering rather than helping the patient. So every patient needs to be addressed very individually. But in the grand scheme, it's really the testosterone that drives the whole cycle.
And who would have known? I had no idea. Yeah.
The more we learn.
Like, who would have known? I mean, I was like, add that to the list of perimenopause issues and menopause issues. There we go. Just one other thing that no one's ever talked about. And I think the other thing that happens to us in that hormonal stage is we often lose hair, which means we also lose eyelashes. And so then everybody's trying to combat, okay, how do I deal with the fact that my eyelashes are thinning now as a result? And so, can we talk about eyelash serums just for a minute? Because this definitely resonates with me. And I know a lot of people who try these things, and you definitely have some opinions about the serum. So, would you mind? It's a little off topic, but yet not off topic. Can we talk about
Not at all.
eyelash serums? Because for those of us in menopause that are losing our hair, we also are losing our eyelashes and they also aren't growing as long. And so then people tend to want to move into fake eyelashes, which I'm personally not a fan of. So I would love your take on, is there such a thing as a safe fake eyelash? And if someone wants to use these serums to try to get their eyelashes to grow, what should they be looking for to be the most beneficial product that is still going to protect their eyes and not cause damage?
Lash serums are such a double-edged sword because just like you explained, everything is starting to change. You are losing the lashes. So now you're using the lash serum that will work. And there are a couple of out there that will work, but they will actually cause more irritation and more redness and more hyperpigmentation. And some of them actually have been shown to cause atrophy of the fat that coats the eyeball. So now your eyeballs look more sunk in. And now you look older with these long lashes. So it's just, you have to understand that there's always a negative in the positive, right? So we need to find a balance. So I would definitely, if you're one of these, patients that are noticing your lashes are starting to thin out, it's okay to use lash serum, but make sure you avoid the ones with prostaglandins. So you want to have an eyelash that has some peptides in it, some nourishing ingredients, but nothing with prostaglandins. With that being said, there are serums out there that do not disclose their lists, full lists to the public. And you may think you're using a healthier version of the lash serum, but it actually will have the prostaglandin in it. And over time, you will notice a lot of irritation and pigment settling in the lash line. So if you're using one of those, definitely stop and see an eye doctor because that means there is a prostaglandin, which will aid you down the road. Anyways, I can write a whole book
Who
on
knew?
this because every time there's a new serum, I test it on myself
Yeah.
because I do need to know because these questions every day, every patient
Yeah.
has the
of course.
questions.
Yes,
Yeah.
of course. We all want to know, like, can we use this? Do they work? Is this good for me? And especially when there are new things like serums like that, there isn't all this research out that shows you that, oh, by the way, you use that product and 5 years from now, you don't have any eyelashes at all because you killed something else that we don't know about yet. What about fake eyelashes? Are those okay? Or let's just say, is there a safe way to wear fake eyelashes in let's just even leave it at that. Is there a safe way to wear fake eyelashes?
Yes.
Okay.
When I started practicing, I was very much against it because, when you leave the school, you're like, it's black or white. Like, we're going to do this or we're not going to do this. And then over time, I've learned I am losing this war so hard. I just might as well join everyone and figure out a better way. How can I educate my patients? So really the formula is if you're one of these patients that you like to wear lash extensions, fine. Make sure when the lash artist that plays the lash individual, they don't glue multiple lash extensions onto one lash. That's already so fragile and you're about to lose that lash. Just do the ratio is 1-to-1 ratio, less glue.
Mm,
And make sure you clean the lashes every night. And the best way to clean the lashes is do you use a makeup brush that has bristles? So it's like the eyeshadow brush with bristles. You use some soap, which is usually they have it for you. If not, I'm happy to make recommendations. And you will actually wash the lashes as if you want the bristles to wash around the lashes. So that way
mm,
you have no dead skin, no makeup, nothing trapping. Because if you don't clean the lashes, that is how you run into styes, those infected lids issues. So
yeah.
1-to-1 ratio, less glue, wash them every night. That's it.
Okay. That is a good way to get on board. Okay. Styes. You mentioned styes. I feel like, my boyfriend just had a sty. And I'm like, how did you as a guy get a sty? Like, I kind of understand. I think women get it because your glands get clogged and we all wear makeup. And not everybody's good about throwing out their makeup every month or 2 months or 3 months or whatever the rule is, especially with mascaras and stuff. But can you explain a sty? Like, what is that?
So we have a lot of oil glands in our lid margin, and the openings right in the waterline. And there's lower meibomian glands are called meibomian glands, and the upper meibomian glands. And when one of these meibomian glands gets blocked and the oil is unable to come out, it gets infected. So a sty is just an infected oil gland. With that being said, often, and the literature shows us that these patients that get styes, it's actually these mites that live on our skin is the reason why patients get styes. So when like your boyfriend, he should have an eye exam to see if he indeed has these mites and we can treat it and he will never have a sty again. We can
He's
prevent it.
he's coming to you. Don't you worry.
Thank you.
I was like, you have to go see her. She's right in Greenwich. Like, let's stop using
Yes.
Dr. Google and and let's go and see you. All right. Before we move off of some what I'm considering cosmetics things, I would just love your opinion on how often should women replace their mascaras?
Um, Whatever the recommended time is. So when you look at the tube, there you will see like a little box, and it has 3 or 6 or whatever. You just follow that. There's really, the mascaras now, they have preservatives. So I'm not really worried unless you had a really bad pink eye, which is a viral conjunctivitis, you maybe want to throw that away. But the mite situation is really just don't share your mascara and just throw it away, whatever the recommended time is, which is usually 3 months for mascaras.
Okay.
Follow the recommended thing. But
Okay.
no one does. That's
No
the
one does.
problem.
Yeah, and we
No
don't
one
realize
does.
it's been 3 months. Like, time just passes. No one pays any attention. No one does. That's for
Exactly.
sure. Right. We don't all clean our brushes like we're supposed to. There are just so many things. Okay, we could talk about makeup for an hour, but we're not going to because there are many other bigger topics we're going to talk about. So, when I went and met you in person, I was shocked to find out how many plastic surgeons that do facelifts send their clients to you. Can you explain why that is?
It's something that we actually have never expected that it would happen. It's just, again, the power of social media, patients and the doctors, we all follow each other. We all talk on DMs, picking each other's brains, which that's why I love social media. But what we realized with all the uptick in facelifts and blepharoplasties, and that's totally expected, patients will have some changes in their lid function. It's expected. So we would have these, patients either find us on social media or on the internet, or plastic surgeons would refer to us post facelifts to restore the lid function. And again, it's something that we're able to do now, which is why I am grateful every day to be able to practice now rather than 10 years ago where we had nothing. And now we have all this amazing diagnostic technologies. We have amazing treatment technologies where we're able to speed up the process of recovery post facelift or post blepharoplasty, any cosmetic lid related surgery. We can really help the patient to recover better and with less unwanted symptoms.
Yeah. So if someone has a facelift and it makes it so their eyes can't completely close afterwards, I don't even know if you can explain it in like an English layman's term, but how can you then fix that? Like, what are you fixing around their eyes or with the structure of their eyes that's helping to fix that for them without it being another surgery? And maybe it is another surgery. I don't know.
So it's really 50-50, but we are, as a community, as eye care providers and plastic surgeons, are becoming more aware of this. So we do get a lot of referrals prior to surgery to get the eyes evaluated and see if there's anything that needs to get addressed prior to surgery. But we still have some patients that have learned about this to be a problem post-surgical. So then we do reactive work. But of course, my passion is preventative eye care. I would rather treat and make it everything seamless rather than being reactive. But it's just really, we're doing a good job educating, especially social media is significant, such a huge tool in education.
Yeah, it's something I would have never thought of until you started to talk about it. All right, so the other thing I had absolutely no idea that existed is this concept of eye drops that can make it so you can read for a day. Can we talk about those? I don't know how I had no idea these exist. Can you talk about what this is, how it works, why it works, how you use it, who can use it, all the things about this concept?
Absolutely. And this is one more reason why I love to be in eye care because it is one of these super growing fields that we had nothing and now we have everything. And now even the eye drop to help you see. So the eye drop is very unique. It's almost like old, rediscovered new, but it actually works. So you have this eye drop that you will use first thing in the morning. And what it does, it makes your pupil small to give you that depth perception, to improve your depth perception, which allows you to see up close. So you don't need to rely on your readers as much as you used to. The one thing a lot of patients that are used to having readers and now they're switching to an eye drop, the eye drop is not magnifying the way the glasses were. So patients
Yeah.
sometimes feel like, oh, I'm just not sure what I'm looking for. It is actually giving you the vision that you had 10 years ago prior to needing reading glasses. It just makes everything crisper, still small, but you're able to read. It just kind of gives you that back time that you had. It's really fascinating. We currently have 3 drops.
That is amazing. Can you use it every day? Is it safe to use on a repetitive basis?
Yeah, just like you would use glasses, you would use this eye drop as a morning ritual. You wake up, you do your thing, you drop, and then you're able to see. Some drops, we currently have 3 different drops that are available that are FDA approved. They found to be safe and effective. So it really depends on the patient, depends on their, the prescription, their habits. I would go based on that and prescribe accordingly. But yes, they're safe, they're effective, and it's a good option for the right patient. We've certainly had patients that have tried the drops and it just doesn't work for them. So you definitely need to see an eye doctor to be able to prescribe this.
Sure. But I would think if you're going to an event or something, like how incredible to not have to wear your glasses and still be able to see the program or the menu or, you get all
Exactly.
dressed up and then you're like, oh, wait, let me pull out my readers so I can read something at the event. It's like, it's stylish, but yet it'd be really cool if you didn't have to.
Well, yes. And I agree with you. And it hurts me to see these beautiful couples at the restaurant, well dressed, the makeup, the hair, and then they take out their tiny pair of readers. And I'm like, please let me help you.
Right. Of course. Now, I'm just personally curious. I have progressive glasses. And so I have both nearsighted and farsighted. And I'm sure I'm like many people, my eyes are not the same. Like most of my difficulties is in one eye and not the other. So if I were to use the drops, it would only help me with seeing close up. It would only help me with reading, correct? It wouldn't help me with seeing far away.
So it depends on the patient. No, we don't know until you actually experience the drop. We've had some patients report that they actually can see better at distance because of
Hmm.
that pinhole effect that the drop makes pupils small. So you just naturally start seeing crisper. But it depends on the patient, which is why the drop is so tricky. Like you actually have to experience the drop to be able to say, yes, it works or not.
Sure. Sure. Yeah. Okay. I'm so trying it. I'm coming in.
I
I
would
can't
love
wait.
to see you.
I can't wait. It's just, I think it's so cool. So, some of the other things that you work on is you work on aesthetics. And I went into your office and you have all these before and after photos streaming on television all over the place, showing people's wrinkles going away. And I was like, wait a second, I'm here for eye care. And yet you were showing like people's chin, their faces, their arms, their eyes, all these body parts of before and afters of wrinkles going away. So, can you talk to us about what is that and how are you using that technology?
So, yes, and I'm so passionate about it because the more I do this, the more I realize, again, your lids are very important. They are, of course, aesthetic. We want to have nice and beautiful and youthful, well opened eyeballs, but lids actually have extreme important function to protecting your eyeball. And as we're treating the lids, as we're treating the eyeballs, we realize the lids are on the face. So we can't really, it's very difficult to separate the lids from the face. There's no a perfect line where the lid ends and the face starts, right? So we started incorporating the facial treatment because those patients, for example, with age, often we have lid laxity. The lids are no longer adhering to the eyeball as well. So when you blink, you just don't have a good quality blink. But then,
Hmm.
as we were treating the lids, we realized the heaviness of the lower face actually pulls everything down. So, yes, we are restoring the lid function, and that seems to be better. But the heaviness of the lower face still is impacts negatively the lid function. So, that's when we started treating the whole face and really taking that full face approach to improve everything at the same time. So we have the technology I picked out to be at the office is a few different ones. We have dynamic muscle stimulation that helps you to strengthen the muscles, and we can work on the face and give you that youthful, more plump effect, but really just to put the face back where it was because it's the bone, and then you have the muscle, then you have a fat, and you have a skin. So if we were to treat, the logic is if we're going to treat the muscle and increase the volume of the muscle, everything else will follow. And
Right.
has shown to be effective. Another treatment is soft wave. I love soft wave because we want to bank the collagen. We want to strengthen the collagen, especially around the lids. So that's something I've started using 2 years ago before it became, Kardashian viral device. I've been using it for around the eyes to tighten the lids, to improve the lid function and aesthetics. And then the light therapy is a huge one that I use to restore the gland function and influence the cell turnover. Everything that is aesthetic, it is actually has an important medical reason. And
Hmm.
combining both and combining the therapies is just been such a huge change for my patients.
That is so cool. And I would also think it isn't one size fits all, right? So it's like, let's say I come in and I'm like, okay, I'm feeling like there's like here, it's not like something's happening here. It's like feeling like your eyes are becoming more concave than they used to be. And so it's like it's sinking in. So what you might do for me might be different than, I have a really good friend who her eyelids at the top, she's in her 60s, are like drooping down and they're sort of like almost like making her eye close because her upper eyelid is just getting heavy. It like doesn't have the elasticity that it used to have. So I would think whatever you would do to help someone like me, if I said this is my issue and help my friend because that was her issue, it would be customized to that person based on what their actual eye issue is at the time. It's not everyone needs to do all the things.
Absolutely. And even if sometimes patients, I have sometimes spouses, a husband and a wife come in and we do the same treatments, but the settings are different, the amount of time we spend. Sometimes patients have the asymmetry where we're able to even out by using these devices. Of course, I work really close with oculoplastic surgeons and cosmetic surgeons, and often I am going to improve as much as I can with whatever I do in my practice. But a lot of times the surgical is really the way to go. So we have such a great relationship with all the cosmetic like surgeons and plastic surgeons and lid surgeons because it has to be a collaborative work. There are certain things that can be improved using technology, and there are certain things that it needs to get addressed with surgical. So
Yeah,
that's
that makes
really the
sense.
the combined approach is really the best. It's really what's best for the patient. That's how I see it.
Sure. How do you stay on top of all this technology? Like, plus have your job and the mom and all the things. Like, how do you stay on top of all of it? That seems like a job inside itself.
Yes, it is. I don't have an answer for that. I definitely the social media and algorithm gods have figured out what I like. But no, it's really I am a member of many boards, advisory boards, and I am part of the industry because I want to learn what's coming, and I just do prioritize my time to make sure to learn what's coming and how can I improve it and how can I bring it to my patients. But it is certainly challenging with time, especially. I wish there was like an extra day in a week.
Yeah, of course, just to do research and learn about new things and go to conferences. So, where is the United States compared to the rest of the world in terms of eye care? Because in some other facets, cosmetic especially, it's sort of everyone's like, oh, the US is so behind. We're so behind in medical care. Our healthcare system is so terrible. Where is the United States when it comes to eye care and technology of eye care?
I think eye care when it comes to United States is way ahead of the rest of the world. Because, and I'm going to speak on my own experience, I do speak and I lecture abroad. It's fascinating how much more experience we have with the technology that's being brought into the United States and how much more new molecules that we have that are being developed. So I do think United States is ahead when it comes to eye care. I will not speak about everything else, but eye care is definitely is ahead. And there are certain molecules that we use here that are not even available in Europe or any other country. You have to be here to be able to get it. So I am proud of that. I think that's, it's great.
I think that is so incredible because I think in general, most people would say they're not happy with our healthcare system. So I think the fact that eye care is more advanced is wonderful. It's great to know we are succeeding and achieving a really high bar in this country with at least one thing. So I think that's great. Can we talk about children for a minute? So share with everybody some of the work you do with the little people and their sight.
When I opened my practice 10 years ago, it was really to address the dry eye and ocular surface and lid function, but also to treat kids, those, especially those children that have been diagnosed with myopia or being nearsighted and have shown to be progressive. So, because right now we no longer view myopia as, oh, just need glasses or just need contacts. It is actually progressive disease. So now that if we have a young child that's at the age of 6 or maybe a little bit older, and they're a little bit negative, like for example, -50 or -1 in prescription, we are taking it very seriously and we're going to be addressing this progressive disease to make sure it doesn't progress further. We have the ability to slow down that myopia progression. And then, when I started addressing this and implementing into my practice, being in Old Greenwich, it gotten so busy, and I was seeing a lot of children that needed the care, but they were not able to get treated because it is currently, even though it is considered a progressive disease, the treatments are still not being covered by insurance. So I started treating these children just because how can you be a mom and let a child just go by and not being treated? So that's when I started my foundation. Actually, it's called I Care from the Heart. I was using that to treat these kids that were unable to get treated. And it's very warm to me. Like, I am very happy about it, that I'm able to help and change the trajectory of the future of these kids. I don't know what it would have been, but for sure it is better than walking around with the glasses on their face.
Yeah.
So it makes me very happy that I'm able to have that impact on their health.
It's so beautiful that you do that, and I know you bring kids in for free eye exams, and you do all kinds of things. The other thing I wanna touch on for kids that I don't wanna skim over that I hadn't even thought about is that sometimes kids are diagnosed in schools with ADHD when in fact or dyslexia, when in fact they can't see, and you've seen some of that in your practice too. So how would a parent know maybe when to go to an eye doctor as opposed to just going to a doctor for, dyslexia or ADHD, which seems super common right now?
Well, first of all, if the parent wears glasses, have the eyes checked. That's number one. If you see the child is squinting, bring the child for an eye exam. But really, the rule of thumb, every child should have an eye exam before going to kindergarten or first grade. That is really
Mm.
should be a rule, just like they get their teeth checked
Yeah.
for a camp. They need to have a dental form for kindergarten or first grade. They should have something like this for eye exams because so many children, for example, I recently saw a child doing well in school, but not doing well in sports. And during an eye exam, what we've learned, she actually can only see out of one eyeball. The other eyeball is nearsighted. So she can only rely on one eye. So her depth is not great. And that's why she's unable to gauge where the ball is. She trips. She's just not doing well in sports. Extremely bright child. So just addressing that and providing a contact lens for the other eye or giving the glasses, she's going to thrive.
Yeah. It's game changing. It changes
It's a
everything.
game. It's life changing and it's game changing.
And it changes her self-confidence because, yeah, the other way, it's like, "Oh, there's something wrong with me. I'm less than. I can't do this. I'm not talented. I'm not athletic. I'm not
Exactly.
this." Where if it's, "Oh, no, it's actually just that there's something wrong with your eye, and so let's adjust that. Let's fix that." And then all of a sudden, you can be a completely different person. It's life-changing.
Absolutely. And that's what I mean. I wish, if you wear glasses, bring your child if they're squinting, but really rule of thumb, have your child's eye examined before they go into first grade or kindergarten.
Yeah, it's a great rule of thumb. And not by I'm gonna just caveat this in my own personal opinion, and not by the pediatrician that makes them stand, like, far away from the alphabet chart that's, like, down the hall. And no offense, pediatricians, but I think I've seen them do that with my daughter when she was little, and I was like, "How are you what does that mean?" Like, really?
Look, it's if there are no available eye doctor in town, I think it's a great tool. Like, just do the screening. But what we
Yeah,
find, kids are so smart, they're so bright, and if they don't see well out of one eye, they will peek out of the good seeing eye. And the nurse, they don't really notice. They don't check the way we check. And this
right,
kid
sure.
would go for years with just reading with one eyeball. The other eye is just not even seeing well.
Yeah,
So
right.
just have the professional eye doctor check.
Sure. Yeah. I love that. Thank you. Okay, before we run out of time, what's on your bucket list for the business? What would you like to see happen in the future for the business?
I think my biggest passion is educating and really improving lives of my patients because most of the time when patients are coming in just for glasses, they're not even aware what we're doing. So I think
Mhm.
educating that, having red eyes or waking up with red eyes is not normal. Having crusty lids, swollen lids, sunken eyeballs is not normal. Like, I just want to educate patients that yes, we're aging. And because often what I hear, oh, it's just, the age. Not really. No, that's no longer the case. We're
Yeah.
able to improve things.
Right.
It's just my age. I don't see well. No, but we have drops for that.
Right.
We're so fortunate to say we have a solution to so many problems now, and we're able to do it really well. So really educating the patients and letting them know that you don't have to suffer and struggle. There's We can do better for our patients.
Sure.
That's
Of
like my
course.
like
And it's
educating, just
yeah.
educating.
Of course. Yeah, like me, I had no idea. I mean, 90% of the things that you do, I had absolutely no idea. But what I love is I was drawn to you because I saw you post on social media about the right shaped glasses to get for your face shape. So you like bring it down to stuff that like I can relate to and that I actually care about. And then I find out that you do all these other things. And now you have a client for life in me. And you'll have one in my boyfriend too. But that's one of the things that I love about you is that you do provide a lot of super practical advice to people on social media of just everyday health and wellness, like everyday health and wellness for your eyes and your skin and your body, which I think is also important because I don't think people give enough attention to their eyes when they think about overall health and wellness. But you kind of like definitely look at it in totality when you talk on a social media platform, which I think is really important.
Thank you. Yes, I think we need to change the way we look at eyes and other organs. It's a part of your whole well-being.
Yeah, it is. And there's stuff you can proactively do to help your eye care, and a lot of people, we
Absolutely.
don't talk about that enough. Okay. So before we get to my favorite question about recommending a book, is there anything that I missed or something that you want to like make sure we put a period on or summarize? What didn't we talk about that we want to make sure we cover?
I think you did such a good job and you definitely covered majority of what I talk about in the exam room. One thing I think is important to address because what I hear a lot in my chair is I need new eyeglasses. My eyes are tired. That is actually literature has shown that tired eyes is not tied to a prescription change or lack of. It is actually the surface of the eye is drying out. So often
Mm-mm.
patients say, my eyes are tired, I need new glasses. It is actually, we need to address the eyes and how they lubricate themselves.
Okay. Sign me up. I've said that. I've totally said that. All right, you made
Yeah.
me think of one more question. I'm going to keep you for one more question longer because I'm wondering about this. Okay, you hear all the time people say, the more you wear your glasses, the more your eyes are dependent on your glasses. And I personally feel like that has become true for me. I wear my glasses now all the time and feel like I can't look at my computer without my glasses. Is that actually factual? And if so, is there anything we can do to reverse that?
I will take this question and answer, and I will pin it on my website because this is every other patient in my chair.
Oh, good. Okay.
They're a little worried if they never worn glasses and now they're at the age where definitely need that reading pair, just to read the menu or read a book. They're a little bit reserved because I don't want to be relying on my glasses. The truth is, there is no literature showing that glasses make you dependent and make your vision worse. The eye is going through the change, whether you wear glasses or not. It's like gray hair. Whether you dye it or not is not going to change how fast you're going to be graying. So the glasses
Okay.
think of glasses as a device. What it does, it just makes it easier for your eyes and your brain to see. If you don't wear them, you're fine. If you wear them, you'll also see great, but you're also fine.
Yeah. Okay. That's really good to know. I love that. Okay. We're going to create a little clip about that. And then you and I can both post it because it's a common question.
And part B to this question is you said it yourself, the more I wear them, the more I want to wear them. And that is true because your brain is really smart and the brain prefers to see clear versus blurry. So patients will say, oh, yeah, but now I have to wear them all the time. You don't. It's just your brain tells you, please put the glasses on. I'm just so tired, squinting and tiring the eyeballs to be able to see. So it's really just your brain is guiding you, like, please, can I see well? So you're not hurting yourself.
Right.
It's if you make a decision not to wear the glasses, you're not hurting yourself, but you may end up with headaches, just squinting on, the
More
crow's feet around your
wrinkles.
eyes, more wrinkles, but you're not hurting yourself. So it's your choice, your body, your
There.
choice.
Yeah,
It's
you're not helping yourself either, though.
no, not at all. Exactly.
Okay.
Exactly.
Thank you for clarifying. You're gonna make me feel better when I have to grab my glasses to look at my computer. I'll feel better about that.
Please wear the glasses.
I know, I wear them all the time now, it's just ridiculous. But I'm gonna come in and see you, and I'm gonna try the drop, so I'm so excited. All right, before we go, I love to ask my guests if there's a book that they would recommend that has impacted them either personally or professionally that they think the listeners and the viewers should read. I think it says a lot about someone, and I love to read the books that people recommend, and I learn and grow so much from a book. So I am curious, what book or books, sometimes people recommend more than one, would you like to recommend that you think people should read?
There's one book that really sticks to me, and I do often actually go back to it and I read certain chapters, and it's The Four Agreements, because I feel like when you're a mom and you're a wife and you're in healthcare, you always feel like you're not enough. So for
Mm,
me, when I at the end of the day, I just ask myself, did I do my best? If
yes.
I'm not able to answer that, we need to go back and redo things. And that's really, I just need to make sure I do my best. And that's how I sleep well at night. And also don't take things personally, because 100% of the time since reading this book years ago, it's just often, you have a negative interaction on the street or something happen, anywhere. You just have to understand oftentimes you can't take that personally, because you don't know where the other person is coming from. Maybe they're having a bad day. Maybe there's just so many things are happening in life in this world today. You can't take things personally, and always do your best. Those are the two things I always teach my son, who I am having read this book now, because he's growing up and there's friends and, relationships. And I want him to not take things personally, because it's often not him.
It's so true. It's such a good lesson for your kids. It's so often when people are bullying you or being mean to you, it is almost is nothing to do with you. It has to do with them. But trying to teach kids that lesson is really hard. But if they can read it in a book, a lot of times that helps to teach that lesson. And that's so important, especially being on social media and especially being someone who's trying to build community. There are going to be people that are going to comment negatively on your content or argue with you about your point of view, especially as a doctor. Find plenty of people that are going to argue with you about your point of view, right? I mean, that's just the nature of the beast of how it works. People like to argue, especially with people they deem as authorities. That's just how it goes. So, having a thick skin and not letting it be a reflection and not letting it impact who you are and standing firm in who you are is so important. So, ah, Ina, thank you so much. You are so incredible. We are going to link everything in the show notes. You have events coming up. You do events all the time in the community. You bring people to your showroom, which is your doctor's practice, which is in Greenwich. You also have one in Darien. You can be found online. I know people fly up here to come and see you. It's not that hard. You're right outside of New York City. There's an airport close to us. And I love how committed you are to educating people. Your passion for eye care, your passion for helping patients of all ages is so beautiful. And you have educated me tremendously. And you now have lifelong customers in myself and my boyfriend. So thank you so much for taking the time. I know you're so busy. So thank you for being such a wonderful guest.
Thank you so much. And you're making me blush. You've said so many incredible things, and I really appreciate your time and inviting me. And I welcome you to my practice. I would love to take care of your eyeballs and
I
your
can't
boyfriend's
wait. And then I'm going to
eyeballs.
talk about it. And then we're going to talk about it on social media. Like we're going to talk about like what's going on and what I learned and how it worked and all that. Like, oh my goodness, I have eczema on my eyelids. Like we have so much we could talk about. And I'm all about
We can.
understanding how my hormones and what I'm doing hormonally and HRT and all the things I'm taking and how that's impacting me. And like there's so much. I might need like a double
So,
block of time on your calendar for us to talk because there's so much. So
which is why our appointment's an hour long, because we just talk.
yes. We need an hour to talk about it all because it's not just
Absolutely.
the fact that I can't see the book anymore. It's about so many other things that are going on.
Exactly.
So many other things. So
Well,
thank you so much, Dr. Lazar, for your time. We will absolutely
thank
be
you.
connected, and I look forward to sharing you and your brilliance with the world. So thank you for being a guest.
Thank you so much.
Thank you for joining us for this week's episode of Building the Best You. If you are ready to take a deeper dive into transforming your life, check out my Empowerment Fundamentals course on my website, houseofjermar.com. Thank you, and I will see you next week with another inspiring guest.